Hello, everyone, and welcome to our Lifewave Connect here in February. It's crazy to believe that we are already through January into the second month of the year here, but we are thrilled to be here with you today. I'd like to take a minute and bring on David Schmidt, our founder, CEO, and inventor of Lifewave technology. David, are you with us?
Hey, Jeff, how are you?
I'm doing really well. How are you today?
Good. Great to see you today and be talking about heart health. As you know, Nova was all about heart to heart. And so I think it's only fitting that we follow this up and talk about how can we protect one of the most vital things we have in our physical body, which is our heart. So very much looking forward to getting into that today.
Well, good. Yeah, me too. In fact, I know as we were talking the other day, we thought, an hour is quite a short time to be able to cover such a vast topic, but we'll jump in and do the best that we can. I was reading on the World Health Organization website this morning, just a couple of statistics, and, cardiovascular disease is the leading cause of death globally, of course, and, affects like 17.9 million people, a year, upwards or downwards a little, depending on the year, but it's a real issue. So David, I guess we can just jump in and kind of talk about, causes and what do we do about this? It seems to be just a pandemic almost a proportion.
Well, let's let's take a step back for a minute and talk about our health authorities.
Mm-hmm.
In terms of statistics, I think when we look at a source like the WHO or the FDA or any Ministry of Health, we have to scrutinize some of these things. Here in the United States, as you probably know, the U.S. government is now $30 trillion in debt.
Yeah.
And so I think we want to ask ourselves a question. Would we trust a government that can't balance their checkbook with health advice? If they can't balance their checkbook, do we really want to take medical advice from them? Case in point, we go back several decades, and the advice from the government here in the U.S., including other governments, was fat is bad. So go on a low-fat diet, and that's going to solve everything. So if you're overweight, fat is obviously the cause. Go on a low-fat diet, and then they gave us the food pyramid. And what happened? We entered into a generation that is morbidly obese. So by going on and recommending low-fat diets, we have here in the United States, 65 to 70% of the population is either overweight or obese. And there has never been higher risks of heart disease, cancer, and diabetes. So all of these things, cancer, surprisingly, is linked to body fat. Some people will find that surprising. What's the connection there? Well, there definitely is a connection, because excess body fat, especially around the waist, is going to set off a cascade of increased inflammation, and this will weaken the immune system over time and make people more prone to diseases like cancer and autoimmune disorders. So very clearly, the advice that we were given about going on low-fat diets did not help. So we have to really scrutinize these things.
Mm-hmm. Yeah, no, I mean, for sure there. And it seems like, well, where do you find the truth? And from your standpoint, what are some of the sources? I mean, we know that it's a problem. We know that it's a huge issue, not just in the United States, but globally. And so we can gather that. But in terms of your recommendations so now where do we go for these types of recommendations or this type of help? What would you suggest for that?
Yeah. So first thing, this is a good point to say that I am not a medical doctor. I'm an inventor. I'm a researcher, and health and fitness has been my passion since I was a young teenager. And so I have spent 50 years, almost 50 years, doing research in health and nutrition, speaking with doctors and scientists all over the world. And I truly enjoy sharing all of this information with our Lifewave community. So, my recommendation is that anyone that would be on here today, take some of these recommendations, go to your healthcare practitioner and structure a program that's right for you. So people are going to be in different circumstances in life with their age, their level of exercise, pre-existing conditions. Are they on medications? All of these things have to be factored in. So what would be good for one person might not necessarily be good for another. These are all things that need to be taken into consideration. But what we will do today is talk about what are some of the causes that are surrounding cardiovascular disease. And then most importantly, what are some of the natural options that people have to address the problem? So instead of taking a blood pressure medication that is not going to solve the problem, instead, what we want to look at, how do we actually treat the root cause? So let's see if we can understand what the root cause is based on information that's already available and what those answers might be.
Oh, it sounds amazing. Yeah, I think that's a perfect place to start. So yeah, what are the root causes, and what are some of the things that you think are causing this issue globally?
Well, it doesn't matter what I think. What matters is, what do the facts tell us? What do clinical studies say? And what does the evidence point to? So let's go ahead and take a look at that, right? So we're going to make this all fact-based. So first, let's go ahead and define the problem. And this is going to be apparently obvious to most people, but it's still worth covering so we have a place to start. And as Jeff mentioned, if we dug into each area of heart disease, if we were talking about the buildup of plaque, inflammation, other factors, this could be a webinar that would last several hours. So this is really going to be an overview, and we're going to go through some of this information quickly because we have a tremendous amount of information to present. But at least it will give you a good understanding of the problem and a number of different methods to address the problem. The other thing is when we're looking at heart disease and having a healthy heart. So this is not just about treatment. This is also about prevention. There are many ways of going about prevention, and we're going to dig into that in quite a bit of detail too. So, of course, conventional wisdom is you have a healthy diet. What does that mean? You have exercise, you get proper rest. These are all different tools that you have for maintaining the health of your heart, but there are many other tools. So let's dig into this. So the first thing is, let's talk about how a person might be at risk for having a heart attack or stroke, and what might we do to prevent this. And I'll tell you right now that if you know that you have heart disease and that you're at risk for a heart attack or stroke, the good news is that first, you'll have enough information after this presentation to go speak with your doctor about a number of different options. That's one. Number two, if you have significant buildup of arterial plaque, and maybe you're at a point where you need surgery, you need bypass surgery. There are non-invasive methods that we'll discuss today for removing the arterial plaque without surgery. This is now proven in clinical studies. So this is potentially important life-saving information. All right, so what happens here? Well, first, in an individual that is young and healthy. We have oxygen-carrying blood going through the arteries without any type of restriction. Over time, there can be, with age, we can get an accumulation of plaque that builds up in the artery, reducing blood flow, and eventually causing a blockage. Another thing that can occur over time is that the arteries become more stiff and less flexible. So these are, of course, highly undesirable circumstances. Anytime that we have structure in the body that is not meant to be there or not part of the healthy body, such as arterial plaque, we're going to have inflammation. As an example, two inflammatory markers would be fibrinogen and homocysteine. Some of this can be genetic. So, for example, in China, there are regions in China where, from a genetic perspective, people are more prone to having elevated levels of homocysteine. And as a result, they're more predisposed to having heart disease, even if their diet and their exercise are in line. And of course, there's things that we can do to get inflammation under control. But these are some of the things that we look for. So, for example, if you went to your doctor and you were to have an inflammatory panel done, you could look at fibrinogen, you could look at homocysteine. And if these inflammatory markers were elevated, then that would be a warning sign that you could have an increased risk of heart disease. Another thing would be to use ultrasound. So, for example, you could go get an ultrasound and you could actually see whether or not the arterial walls had an accumulation of plaque. So that would be another way of determining, are you at risk for a heart attack or a stroke? So these diagnostics are very important. Another one would be for men that are experiencing erectile dysfunction or reduced sexual performance. So many times, erectile dysfunction is psychological, but about 60% of the time, it is an early indicator of cardiovascular disease. So this is something that should not be taken lightly. Now, often men think of erectile dysfunction as being related to testosterone, and low testosterone levels are only part of the problem. So you can give a man testosterone and he doesn't see any change in sexual function. And this is because there's a buildup of plaque in the arteries, there's obstruction, reduced blood flow, and this needs to be corrected in order to have normal performance. So some of the recommendations that we're going to talk about today, if a man is suffering from erectile dysfunction, these recommendations will actually help him quite a bit and also get at the root cause of what's going on in the first place, and that is taking care of the heart and cardiovascular health. Okay, so how does the plaque get there? There are a number of different causes, but the one I thought we would really focus in on today is insulin resistance. And this is going to surprise some people and not others, but when we have, especially here in the West, diets of refined carbohydrates, excess amount of sugar that's in the food, what we see is progressive glycation which is damage of tissue in the body by elevated blood sugar. And we see that the body's ability to respond to insulin decreases over time. So insulin resistance changes as a function with time. And what's so interesting about this is that insulin resistance then can be linked to not only what would be obvious as diabetes, type 2 and then type 1 diabetes, but also cardiovascular disease. So this is, for those that are interested, this is a really interesting article that gets into this in quite a bit more detail. But it will, in fact, show the link between elevated levels, elevated blood sugar levels, insulin resistance, and hypertension, which is, of course, high blood pressure. So what this means is that if we want to, if someone is suffering from high blood pressure and they have an accumulation of arterial plaque, we start to see what it is that we need to do to get a temporary improvement in blood pressure. So someone that has high blood pressure, let's say you've got 160 over 100, right? You're way into the risk zone. What can you do immediately to get your blood pressure under control, right? We are going to talk about that today. But then more importantly, what can you do to prevent this problem from coming back? And how can you improve the health of your arteries so you won't need these Band-Aids? We're going to talk about all of those things. But this is very important because what it's showing is that if we want to reduce the accumulation of arterial plaque, maintain the health of arterial walls, the endothelial lining, that we need to get our blood sugar levels under control. And we need to improve our response to insulin. And there's going to be a number of ways that we can do that. So let's talk about one other factor here, and that's going to be inflammation. So as I mentioned, there are a number of different inflammatory markers, such as fibrinogen and homocysteine, which are directly linked to heart disease. So this is a study that was done on copper peptide, and copper peptide, which we know our X39 patch elevates. Copper peptide is linked to a number of very important things in the body, but one is that copper peptide functions as an antioxidant and also an anti-inflammatory. And one of the markers that copper peptide reduces is fibrinogen. Now, interestingly, what we saw with COVID-19, and by the way, we don't make any medical claims about our product. So I am in no way stating that X39 could be used to prevent heart disease. We haven't done a study on it. We're not making that claim. It's a wellness product. But what's been done with injections of copper peptide is to reduce fibrinogen levels. And so it says right over here, copper peptide suppresses the production of interleukin-6, and interleukin-6 is what stimulates the production or regulation of fibrinogen. So it's pretty obvious if you can restore or elevate your copper peptide levels, you can reduce an inflammatory marker, which is associated with heart disease. So that would be super important. But let's go back and talk about insulin resistance now. And one of the places I want to start with this, actually, I'm going to change my mind here. One of the places I think I want to start with this is going to be with glutathione and alpha lipoic acid. And let me pull it up over here. Okay, so a number of years ago, back in 2005, we had the energy patches and Icewave. And I was fortunate enough to meet a scientist in San Francisco, California, who is doing work on the use of antioxidants in the treatment of diabetes, both type 1 and type 2. And what he was doing was using alpha lipoic acid, and it was called a controlled release alpha lipoic acid. And he was giving people 300 milligrams of alpha lipoic acid 4 times per day. And what he found, which is very consistent with the research, is that alpha lipoic acid moves sugar through the body, bypassing the need for insulin. So the insulin is never released. So there's 2 critical antioxidants here in improving insulin resistance and getting blood sugar under control, and they are alpha lipoic acid and glutathione. So meaning, if you have type 1 or type 2 diabetes, you're going to have low levels of alpha lipoic acid and glutathione. And conversely, if you elevate alpha lipoic acid and glutathione, it is and can be therapeutic. So in his study, he found that type 1 diabetics got a 60 to 65% reduction in their need for insulin. And that's life-changing when you're depending upon injections of insulin. This is life-changing information. So it says right here, this study supports the use of alpha lipoic acid as an antioxidant in the care of diabetic patients. Now we're talking about heart health, but because insulin is connected to heart disease, obviously, we see the connection now. We can use alpha lipoic acid and glutathione to get our blood sugar levels under control. And this is going to reduce the levels of oxidative stress in the body and therefore protect our arterial health. So let's go back over here to a moment, and we're going to talk about another antioxidant called carnosine. Mm-hmm. And carnosine is interesting because it is not only an antioxidant, but it protects the telomeres, so it has life extension effects, but it's the most powerful anti-glycation nutrient that's known. So what that means is that when we get high levels of sugar, and of course we're at risk for diabetes and heart disease, carnosine can protect the cells in the body from damage. It's the most powerful one that's been found. So this was a nice article from Life Extension that showed some of the many, many benefits of carnosine. Now, of course, this is done with oral carnosine supplementation. Carnosine is a dipeptide, and if someone is a vegan, they may have low levels of carnosine. The key amino acid in making carnosine is alanine, and you want to take a form called beta-alanine, and the beta-alanine is used to make peptides. So you could find carnosine and alanine in red meat. So if someone has a diet low in red meat for some reasons, some good reasons, they may want to supplement with beta-alanine just to be sure. But you can see right here, carnosine lowers blood glucose. So it is going to, if you're taking an alanine supplement to elevate carnosine, because we don't make medical claims about our products, that's a way to help to protect you. We talk a lot about the studies that we've done with carnosine with cognition and improving athletic performance, but we know that long-term carnosine can potentially keep people younger longer. And here it is right here. Carnosine is a natural antioxidant and anti-glycation substance. So it'll predominantly protect the brain and the heart. Carnosine helps prevent cardiovascular damage and brain injury through a host of mechanisms, but basically because we find high levels of carnosine in the heart, this is going to protect the heart from oxidation. And then, of course, as a result, we're not going to see that inflammatory stress. Okay. Let's take a look at another study here. And when we're looking at what's the kind of, what do we see any evidence in the use of carnosine in the health of the heart, there are a whole host of studies. Quite a few studies, not surprisingly, have been done on mice and rats, but there's certainly plenty of studies that have been done on human beings. So when we look at animal studies, they may or may not be indicative of what type of results we might see in human beings. But fortunately, there are enough studies on carnosine in human beings where we can say definitively, yes, carnosine does in fact play a role of protecting the heart from damage. So this is a very good study if you want to take a look at it, but it gets into how much carnosine is needed to see this effect. And if you're wondering, a good supplement might be 1,000 milligrams of carnosine per day. You have to be careful with taking too much carnosine. Yeah, here we go. You want to be careful about taking too much carnosine because carnosine can cause a rash on the skin. And if you take too much, and it can be a little painful, it can cause almost something very similar to a niacin flush. So I would start small with maybe 500 milligrams of beta alanine, and then maybe go up to 1,000 milligrams of beta alanine to support your carnosine levels. But this is really interesting information because it does get into the mechanisms by which carnosine actually does protect the heart. Another mechanism here, I'll just mention it briefly as an aside, is carnosine as a pH buffer. And I'm very interested in looking at the use of carnosine as a treatment and preventative for cancer. Because one of the things we see with cancer cells is that they produce a lot of lactic acid. And when people exercise, if you're exercising hard, you know that you're sore the next day. And this is from lactic acid. And when you elevate your carnosine, it helps to act as a buffer to neutralize that lactic acid. So my suspicion is that there is a role for the use of carnosine in protecting people from cancer, and maybe even as a therapeutic. It wouldn't be something that I would rely on, but it's a piece of the puzzle. I'll look at it that way. Okay. Let's talk about glutathione for a minute. And we may not normally think of glutathione as being used for maintaining the health of the heart, but because glutathione is body's master antioxidant and it's found everywhere, almost everywhere in the human body, it tells us that glutathione is critically important to our health and longevity. So in a similar fashion to lipoic acid, we see that glutathione assists in maintaining healthy blood sugar levels in the body. Interestingly enough, there was a study that I saw on erectile function in men, and men that have better erectile function have higher levels of glutathione. And also, there's a correlation between glutathione and testosterone levels. And this is because glutathione, and also there's similar data on alpha lipoic acid, these antioxidants can protect the testicles from oxidative stress and help maintain a man's testosterone levels. So, of course, we know glutathione and lipoic acid are also critically important for the health of the skin. So this is to say that if you're interested in maintaining your cardiovascular health and balancing out your insulin response, elevating your glutathione levels and your lipoic acid levels is going to have a whole host of benefits. It's going to balance out your blood sugar. You're going to feel better. You're going to have better quality skin, better functioning immune system, better cognitive function, recovery from exercise. Huge benefits here from elevating glutathione and lipoic acid. So you may initially do this to support the health of your heart, but there's going to be all these ancillary benefits. Okay, now let's get into the question of what do you do if you already have arterial plaque and you already have high blood pressure? What can you do? Well, the good news is that there are things that will work immediately. And we're going to talk about several of those things now. And by the way, we're also going to talk about what studies we've done with our Lifewave patches. I don't want to forget about that. That show we can use patches to have a beneficial effect on the heart. We are going to talk about those studies. But one natural substance that's been known maybe for thousands of years to have beneficial effects on the heart, and it's garlic, and probably more specifically an aged garlic extract that's rich in a compound called allicin. But garlic has, unless you're allergic to it, garlic has consistently been shown to reduce blood pressure, and also studies are showing it can be used to reduce arterial plaque. You can also use garlic to elevate nitric oxide. So let's go back to the example that we used right in the very beginning. Let's say that you have high blood pressure and you have a restriction here that is impeding blood flow, and this is what's driving your blood pressure up. If you take, let's say, 1,000 milligrams, 1,200 milligrams of a garlic extract, along with 2,000 milligrams with vitamin C, you can triple your nitric oxide levels. Nitric oxide, of course, is a vasodilator and will cause an expansion of the blood vessels, reducing arterial pressure. So this is really important because it will gives you a way to start to immediately reduce your blood pressure. It may take a little while of repeated use, but you can start to see your blood pressure come down. I'm going to give you also a whole host of things that you can use. But anyway, an important thing here is that in the short term, garlic and vitamin C elevate nitric oxide, reduce blood pressure. In the long term, garlic, some studies show that it can reduce high cholesterol levels, which cause damage to your endothelial lining. But some studies also show that it can reduce arterial plaque, helping to eliminate the problem in the first place. So that's really, really good news. I'm going to show you some other things, though, here, too. Now, I have been really excited about research that we're doing here on taurine. And taurine is a amino acid, and it's a very simple amino acid. And it's found in the brain, the heart, and in men, it's found in the genitals. And what's interesting is that as important as taurine seems to be, the method by which taurine acts in the body is not completely understood. And taurine also declines with age. So I would say that there is a link between taurine and aging. We may even see life extending effects by elevating taurine over time. So it's not, even though it's a simple molecule, I would not dismiss its importance. Now, what does this have to do with heart disease? Well, many studies have shown that taurine is not only safe because it's an amino acid, it is more effective than blood pressure medication. This, if you have high blood pressure, this actually would be the first thing I would recommend that you try, along with a number of other things, but I would put this very, very high on the list. The dosing is, again, speak with your doctor, but the dosing is roughly 3 to 5 grams of taurine per day. So, for example, you might take 1,000 milligrams of taurine 3 to 5 times per day. Or maybe you take 1 gram of taurine with breakfast, 1 gram with lunch, and then 2 grams at dinner. You're going to find that the taurine helps your body to relax. So if you're under a lot of stress, taurine can help to relax the nervous system, but it gives dramatic reduction in high blood pressure. It can even get people back into a normal range. So I would definitely speak with your doctor about including taurine in an overall program of diet, exercise, and supplementation. It's very, very high on the list. All right, let's go through some other things here. In addition to some of the things that we've already talked about, I would also recommend fasting. And here's the importance of fasting. And again, the recommendations would be a little bit different for men than for women. But the simple thing is fasting induces autophagy, and fasting helps your body get control over its blood sugar. So we're going to accomplish a couple things with fasting. The first thing is it's going to be completely free, and it helps to normalize and give you better control over your insulin sensitivity. It gives you improved insulin sensitivity and more stable blood sugar levels. So you're going to be able to interrupt the problem where it starts. The other thing is that when you fast, you're going to tear down damaged tissue in the body, and it's going to facilitate the removal of arterial plaque. So fasting creates an environment in your body that is conducive to cardiovascular health. And a ton of information there we don't have time to get into. Let's skip ahead to some of these other things. When we're talking about removing arterial plaque, which is going to be something you want to focus in on if you have high blood pressure, you have a number of different choices here with all very, very good clinical evidence. So, for example, vitamin D, you want to speak with your doctor about taking 5,000 IUs of vitamin D daily, because this helps with the elasticity of the arteries. It keeps them supple instead of becoming stiff. Also, this supplement Cyruta, which is a buckwheat seed extract, has been shown to remove arterial plaque. There was a study, I didn't pull it up here just in the interest of time. There's a study with pomegranate extract. So, for thousands of years, pomegranate goes back to ancient Egypt, and it was known as being something good for your heart. So I think the Egyptians, if they could build the pyramids, they could probably identify a fruit that's good for the heart. And there's an important reason for this. It's been shown that pomegranate extract will, in fact, remove arterial plaque. There's a study that shows if you take pomegranate extract for 6 to 9 months, you can completely remove the arterial plaque and eliminate the need for surgery, bypass surgery. So it's one of the most powerful natural substances known for heart health. And this is because of its ability to remove arterial plaque. And it's a shame that cardiologists are not taught this because it saves people's lives. Niacin, of course, has been around a long time, and it's very well known. There's different forms of niacin. You've got to speak with your doctor about this, but it's very, very well known that niacin can improve the strength of the arteries and also lower cholesterol. Niacin will, of course, produce what's called the niacin flush, which is uncomfortable. And there's other forms of niacin, but they may or may not have the cardiovascular benefits. So speak with your doctor about that. Now, another thing that lowers blood pressure immediately is magnesium, but there's a little bit of a trick here. If you're looking at just magnesium for overall health, then a magnesium glycinate would be a good form to take. However, if you have high blood pressure, I'd recommend taking magnesium threonate. Magnesium threonate will give you an immediate effect at making you extremely relaxed. And as a result, it will lower your blood pressure. Another thing that you can do is you can take a hot bath in Epsom salts, which of course is magnesium. And you'll notice that your blood pressure will come down in a hot bath of magnesium. The magnesium can go directly into the blood. There's also magnesium gel, which you apply to your skin, and this allows the magnesium to go directly into the blood. It'll elevate magnesium very rapidly, but magnesium is a very simple, safe way to lower blood pressure. And then some of these other recommendations that we have already talked about. Just one or two other things before we wrap up on this section is it's worth investigating ginkgo biloba and black ginger. Now on ginkgo, there's products on the market that are either fake or they don't have the real active ingredients. So you want to use a reputable company, but ginkgo is well known for improving blood flow. Black ginger as well. It's a treatment for erectile dysfunction because it improves blood flow. And black ginger also can help to reduce blood pressure. So these are all some natural things that you have options on. Again, I would definitely recommend that you get some guidance from your healthcare practitioner, find out what's good for you, but you have a whole arsenal of different things here. Okay, last thing that I want to go through quickly is in the research section of the website, you're going to see we have a tremendous amount of information on the use of the patches in supporting the health and function of the heart. Some of these studies are with heart rate variability. So this one, for example, was done at the University of Texas in El Paso by Dr. Homer Nazaran. And this is with our energy patches. And basically heart rate variability is measuring the muscle contractions in the heart. And you get a ratio between low frequency and high frequency contractions. And essentially what we found was that the energy patches, along with others, improved heart rate variability. Here's another paper, another study that was done at UTEP on heart rate variability and the patches. This was a published study in the Journal of Neuropathy by Dr. Tom and Helen Budzinski. And this one as well, heart rate variability on energy patches, showing that it improves HRV and also reduces stress. Thought it showed this one, which would be interesting because this was done with Lifewave, which also improves heart rate variability, but you can see helps to manage the inflammatory response. So what's the benefit of HRV? Relaxes the heart, relaxes the nervous system, gets the inflammatory response under control. And then here was one on EON, again, where we're using EON to measure stress reduction and its beneficial effects on the heart. So I know I went through that really quick, and this really would have required, a few hours to go through everything and give it its proper due. But really, the point of this was to give our community a whole list of different tools to understand what's the problem, what's the underlying cause, and what are some natural tools that we can use to maintain the health of the heart, prevent heart disease, and if people already have high blood pressure, how can we reverse that and prevent it from coming back?
I think it was absolutely incredible information. That phrase "drinking from a fire hose" comes to mind because there's just much good. So no, it's amazing, and the questions are flying in. And I know we're down to just about 10 to 15 minutes here left of time. So we talked about alpha lipoic acid, carnosine, glutathione, garlic, vitamins. Just a tremendous number of things that can help with all of this. The first question out of the gate would be, David, in terms of just everyday food and diet, are there any recommendations for more of a heart health focused type of diet that you'd recommend?
Yeah, of course. So first thing that I would say is if someone has, let's say, type 2 diabetes or type 1 diabetes, I would be focusing on a diet that would be low in carbohydrates and something that would be more rich in protein and healthy fats. I would be including foods, and this is all to say that if someone is not allergic to a specific food, like let's say avocados, right, or olives, you want to have foods that are rich in monounsaturated fats, such as avocados and olives or olive oil, because they're going to help to manage the inflammatory response. The ketogenic diets, of course, are going to be fantastic in this because they're going to help to balance out, improve insulin sensitivity and balance blood sugar. Fasting, as I've already indicated, is critically important. But in terms of diet, I would say definitely reduction in carbohydrates, reduction in sugar.
Okay, wonderful. There are a lot of questions coming in. You talked a lot about carnosine, and of course we have a patch, carnosine. And so there's a lot of questions coming in around the usage of the patch versus a supplement versus the two of them together. How do you see those working together, and what would your recommendations there be?
So let's say we took glutathione as an example. So when we're talking about the use of glutathione in treating a health condition, we're referring to the information that's out there on injecting glutathione into the body and oral supplementation, because we only make wellness claims about the patch. So if someone were interested in elevating glutathione, they can use our patch, but they have to look at their diet. Do they have a source of cysteine? And are they using this therapeutically or just as a detox? So what I would say is on things like glutathione and carnosine, if they're concerned about heart disease, I would be taking a beta-alanine supplement and an NAC supplement to make sure they're getting those amino acids in their diet, and then they can use the patch to help maintain the levels of carnosine and glutathione. Another way to look at it is that if you take an NAC supplement, the levels of glutathione go up and down. If you use the glutathione patch, the glutathione levels stay elevated. So that's the biggest difference between the supplement and the patch. The patch helps to keep the glutathione levels elevated.
Oh, that's fantastic. There's another one, and again, I know we've talked about medical disclaimers and things, so I want to be cautious about that. But several questions around, a pacemaker and the use of patches. Is there any issues there that you foresee, or any comments on that?
So we had this question come back up in 2004 when we were first launching, and we have many people with pacemakers that use the patches. We've never seen any issues with that. But because it is a serious health condition, we have to recommend that a person see their doctor and ask their doctor if it's okay. But all we're doing with the patches is stimulating the body with light. So there's should not be any interaction with a pacemaker.
Okay, perfect. This next question comes around X39. And so this individual is asking, what happens when you discontinue taking X39? Do the anti-aging gains revert to the way they were, or do you just start kind of from that point? Just maybe a little bit more commentary on that piece.
Yeah, the way I would look at this, that's a complicated questions, and the answer is lengthy. There's a lot of details there, but the simple thing is when you stop using the patches, you stop getting the benefits, just like vitamins. So let's say that you got 10 years of age reversal and you said, well, I'm happy, I'm going to stop using it. You wouldn't all of a sudden, age very rapidly. You would start aging normally again. But the easiest way to think about it is that it's really no different than vitamin supplements. If you stop taking them, you lose the benefits.
Yeah. Okay. There was a few comments too around garlic and the DNA telomeres. So there's some question around does it actually reduce the length of those, and does the recommendation for garlic conflict with the anti-aging message there?
That's an interesting question. I used to worry about that, but I don't worry about it anymore. But I have some privileged data, so I would say it that way, because we are in fact doing research on telomere lengthening. But yes, there is if you keep in mind, the purpose of this and recommending garlic is for people that have high blood pressure and potentially are at risk of a heart attack or stroke. So I wouldn't be worried about living another 20 years. I'd be worried about, are they going to live another 6 months or a year? And what damage are they doing to their health? So the whole purpose of this was to say, use garlic as a tool to get your blood pressure under control, use it to help support the removal of arterial plaque. And then once everything is stable, then you can go off the garlic. You don't have to use it. There are many other benefits to garlic. It's a very, very powerful antibacterial, antifungal. But there is potentially a concern that it could inhibit lengthening the telomeres. But we have data to suggest that you could still use garlic. It's still going to lengthen the telomeres when you do certain things. But again, the whole purpose of this is to help people at risk for heart attack. So I would use garlic as a tool.
Perfect. You talked a little bit about fasting and intermediate fasting, and I know that there's always some questions around, intermediate fast or intermittent fasting, and talking about, what counts and what doesn't count in that. For example, if you were to use tea or coffee or drink, those types of things. Any thoughts on that, or any suggestions based on the data you've seen?
Oh, lots of thoughts on that. So first thing is, there are any number of different studies on intermittent fasting, and that's a whole other webinar in and of itself. But and there's different ways of fasting. The way a man and a woman fasts are different. But let's just say, for the sake of example, that one method that I use that's very popular is to eat within an 8-hour window. So let's say 11 a.m. to 7 p.m. and then fast for 16 hours. That seems to work very well. So it's a long enough fasting period that you can get your hormone levels up, like growth hormone levels, you kick your body into autophagy, and you help to manage out your blood sugar, right? So some people, though, they might want to go without food 1 day a week. That's another method of practicing intermittent fasting. I think it's pretty rough. Other people, if they really want to optimize their body mass index and spike their growth hormone, then you're eating within a 4-hour window. That's pretty aggressive. So it depends on what your goals are. But if the goals are cardiovascular health, then I would say if you're eating within an 8-hour window and you're not having any calories in that 16 hours, but you're drinking water, you can have tea or coffee, but without any sugar. You can have things like stevia, that's okay. You can have vitamin water because it's no calories. But yeah, you want to limit your calories to like 30 calories in that 16 hours. Perfect.
Well, believe it or not, we've hit the end of the time again. So this has been fantastic. David, what I'll say is, at the beginning, you talked about the theme this year for Lifewave being heart to heart. And I know one thing that I appreciate, and one thing that I've seen several comments on here is we're just really grateful that you're willing to open your heart and share these things with us. This really life-changing advice and life-saving advice. So we really appreciate that. Before we end here, is there anything else that you want to share with our community?
Oh, that's a loaded question, Jeff, because there's always could keep going for a while here. But one thing that we didn't have a chance to really cover, and that is, of course, every organ in the body is associated with an emotion. And of course, the heart is always associated with love. And when people are in a state of anger, you can see the negative consequences that this has on their body: elevated levels of stress, elevated levels of inflammation, and this puts people at risk for heart disease. So, I think what I'd say is that we've talked a lot today about these physical things that we can do to prevent and reverse heart disease. But really, where this is going to start is on the spiritual level and on the emotional level. If we relax, we meditate, we de-stress, we pray, we love, all of these things are going to dramatically support the health of our heart and give us a better quality of life. So probably the best thing that we can do in all of this is maintain a healthy spiritual state and a healthy emotional state. Give thanks to the ones that we love that are in our lives. Give thanks for everything that we have. Give thanks to God who created us, and we'll have a happy and prosperous life.
Oh, amazing and beautiful advice. Well, as always, David, thank you so much for taking the time. Really appreciate it. For everyone in our community, thank you so much for joining us. Thank you for taking the time. We appreciate you and we love you, and we will talk to you soon.
Thank you, Jeff. Thanks, everybody.